The box sits on my kitchen table like an accusation. Cardboard, unremarkable, the kind you might use to store old tax returns or photographs you can't quite throw away. Except this box doesn't hold receipts or memories. It holds gratitude. 20 years worth of it, delivered in envelopes with careful handwriting and stamps from places I've never been. I wheel myself closer, my hands finding the worn armrests of this chair I still haven't gotten used to. 6 months in, and every morning I wake up expecting my legs to work. Every morning, the same disappointment. The letters spill across the table as I tip the box. Cards with flowers on them. Printed thank you notes. A few photographs of smiling families. I pick one up at random. Dr. Cole, you gave us 3 more months with Dad. He got to meet his first grandson. We will never forget what you did. I set it down carefully, like it might burn me. Another one, this time on pale blue stationery with a watermark I can see when I hold it to the light from the window. You saved my husband's life. The doctor said there was no hope, but you didn't give up. Thank you for giving us more time. More time. That phrase shows up in almost every letter. More time for birthdays, for weddings, for one last Christmas. More time to say goodbye. More time to say I love you. I used to keep these letters in my locker at the hospital. On the hardest nights, when I'd lost 2 patients in a row and felt like I was drowning in my own inadequacy, I'd pull one out and read it. Remind myself why I did this work, why I pushed myself past exhaustion, past burnout, past the point where my marriage fell apart and my daughter learned to stop expecting me at her recitals. Because people needed me. Because I could do what others couldn't. Because as long as there was a pulse to fight for, I fought. The letters kept coming even after the accident. Former colleagues forwarded them to my new address. This adapted apartment with the wider doorways and the shower with grab bars that I still hate looking at. I think they meant it kindly. A reminder of my legacy. Proof that my career mattered, even if it was over. I should have thrown the box away. Instead, I keep pulling out letters, scanning the familiar phrases. You're a hero. You're a miracle worker. You gave us hope when there was none. The words blur together, losing meaning through repetition. Then I find the one that doesn't match the others. Plain white envelope. No return address. My name and address printed on a label, not handwritten. Something about it makes my hands hesitate before I tear it open. Inside, a single sheet of lined paper. The handwriting is uneven, pressed hard into the page like the writer was angry. Or crying, or both. Dr. Cole, you don't know me. You probably don't remember me. I was just another case file, another set of vitals, another body you pulled back from the edge. Everyone says you're a hero. They write you letters thanking you for saving their loved ones. I bet you keep those letters. I bet they make you feel good about yourself. I'm writing to tell you something different. You are not my savior. You had no right to make that choice for me. That day when you brought me back, when you shocked my heart into beating again, when you forced air into my lungs, when you refused to stop, even when I was already gone, you didn't save me. You sentenced me. I begged them beforehand. I told them I didn't want this. I told them to let me go. But you didn't care what I wanted, did you? You followed protocol. You listened to my family who couldn't let go. You played God and decided my life was worth more than my choice. Do you know what my life has been since that day? Do you know what it's like to wake up every morning in a body that doesn't work anymore? In a mind that remembers what it was like before? Do you know what it's like to be grateful you're alive when every fiber of your being wishes you weren't? You didn't give me more time. You gave me more suffering. I hope you never understand what that feels like. But if you do, maybe you'll finally get it. You should have let me die that day. The letter shakes in my hands. Or maybe my hands are shaking and the letter is still. I read it 3 times, then a 4th. The words don't change. The anger doesn't soften. The pain doesn't fade into something I can explain away or rationalize. I try to remember, Try to place this person in my mental catalog of saves. 20 years of ICU shifts, thousands of patients, hundreds of codes. Which one was this? When did I make this choice that they're describing? What were the circumstances? The details are gone, blurred by fatigue and time and the sheer volume of emergencies I've handled. But the pattern is familiar enough. Family begging me to do everything. Patient unresponsive, unable to speak for themselves. Protocol dictating that we err on the side of life? I did what I was trained to do. What I was supposed to do, didn't I? Outside, the afternoon light is fading. The apartment is quiet except for the hum of the refrigerator and the distant sound of traffic. I sit at my kitchen table, surrounded by letters of gratitude, holding the one letter that calls me something else entirely. Not a hero, not a savior, a sentence. I spent 20 years fighting death in the ICU. I thought the worst thing was losing a patient, the flatline you couldn't fix, the family you had to face in the waiting room with the worst news imaginable. I measured my worth in the ones I saved, the hearts I restarted, the lungs I kept breathing. I never thought about the ones who survived and wished they hadn't. I looked down at my legs. Useless. Unresponsive. I've spent 6 months learning to live in a body that won't obey me anymore. Learning what it means to need help for things I used to do without thinking. Learning the difference between being alive and being able to live. And for the first time since the accident, I understand what this person is trying to tell me. I pull the box of letters closer and dump them all out on the table. Dozens of them, maybe 100. All these voices telling me I did the right thing. Except one. One voice saying I didn't. And I don't know which one I believe anymore. The alarm goes off at 4:45 a.m., but I'm already awake. I've been awake since 3, staring at the ceiling of my apartment, running through yesterday's cases in my head. The sepsis patient in bed 7 who wasn't responding to the antibiotic protocol. The post-surgical bleed in bed 12 who might need to go back to the OR. The elderly woman in bed 4 whose family still hadn't made a decision about the DNR order. Sleep used to come easier. Back when I was a resident, I could collapse into bed after a 30-hour shift and be unconscious in seconds. Now, 15 years into this job, my brain won't shut off. Every decision I made replays on a loop. Every patient I couldn't save haunts the space behind my eyelids. But I don't need sleep. I need coffee. The drive to University Medical Center takes 20 minutes in the pre-dawn darkness. The teaching hospital rises against the skyline like a monument, all glass and steel and the kind of architectural ambition that screams, "We save lives here." I park in my assigned spot in the physician lot, grab my travel mug of coffee, my third of the morning, and head inside. The ICU is on the 7th floor. I take the stairs. Not because I'm trying to stay in shape, but because the elevator is too slow and I'm already running the morning checklist in my head. Who deteriorated overnight? What labs came back? Which residents are on rotation this month and which ones I can actually trust? The unit smells like antiseptic and recycled air. Machines beep in steady rhythms. The night shift nurses look up when I walk in, and I catch the subtle relaxation in their shoulders. Day shift is here. The attending is here. Whatever went wrong overnight, it's my problem now. I'm halfway through morning rounds, standing at the nurses' station reviewing charts when the alarm sounds. Code blue. Bed 9. My body moves before my brain fully processes it. Down the hall into the room where a middle-aged man is seizing, his monitors screaming. The night resident is already there, fumbling, panic in her eyes. 2 nurses are pulling the crash cart. I step in and the room reorganizes itself around me. The patient's rhythm on the monitor is chaos. Ventricular fibrillation. His heart is quivering uselessly instead of pumping. Every second without blood flow to his brain increases the chance of permanent damage. I move to the head of the bed. One of the nurses is already doing compressions. Good. I check the airway, position myself. The room waits for my voice. The resident is holding the defibrillator paddles, looking at me for confirmation. I nod. She charges them. The whine of the machine fills the space between heartbeats. The body convulses. The monitor shows the same chaotic rhythm. Again. The smell of ozone and sweat fills the room. Third shock. This time, the monitor changes. A rhythm emerges. Weak, thready, but there. A pulse. The room exhales collectively. The nurses adjust IVs, check vitals, document everything with practiced efficiency. The resident steps back, her hands shaking slightly from the adrenaline. I stay at the bedside, watching the monitor stabilize, watching the patient's chest rise and fall with the ventilator. Another save. Another name I probably won't remember in 6 months, but another pulse that wasn't there 3 minutes ago. The resident approaches me as I'm updating the chart outside the room. Her name is Amanda, fresh out of medical school, still young enough to look at this job like it's noble instead of exhausting. She wants to say thank you, I can see it in her face. Wants to tell me I made it look easy. I cut her off before she can start. The words come out harsher than I intended, but she needs to hear them. This job doesn't have room for hesitation. You don't get time to think. You just act. She nods quickly and hurries away. I watch her go, feeling the familiar burn of too much coffee and not enough sleep. Feeling older than 45. The shift continues. More rounds, more decisions. A family conference where I have to explain why their father isn't waking up from his induced coma. A consult with surgery about another patient's declining kidney function. 2 more codes before noon, both successful, though one required 4 rounds of epinephrine and left me wondering if we brought back enough brain function to matter. I don't stop for lunch. There's no time. I drink another coffee. My hands shake slightly when I hold the cup, but I tell myself it's just the caffeine. By late afternoon, I'm in my office, a cramped space barely big enough for a desk and 2 chairs, when my phone buzzes. A text from my ex-wife, Sarah. Sophie's recital is tonight, 7 p.m. She's been practicing for months. I stare at the message. Sophie? My daughter? 16 years old. The violin recital. I'd forgotten completely. I text back quickly. Can't make it. Emergency with a patient. It's not technically a lie. There's always an emergency. Someone is always coding. Someone's family is always waiting for news. The ICU doesn't operate on a schedule that allows for school recitals. Sarah's response comes immediately. You said that last time. I don't answer. What's the point? She knows what this job requires. She knew when she married me. She certainly knew when she divorced me 2 years ago. The phone buzzes again. Your daughter asked if you're coming. What do I tell her? I close my eyes. I can picture Sophie on stage, violin under her chin, scanning the audience for my face and not finding it. I can picture the disappointment she's learned to hide behind a smile. I can picture Sarah comforting her afterward, telling her daddy's job is very important, that he saves people's lives. And it's true. I do save lives. I save 3 today alone. 3 people who would be dead if I weren't here. 3 families who get to keep their person for a little longer. Sophie has to understand that. Eventually she will. I text back. Tell her I'm sorry. I'll make it up to her. Another lie. I've been saying that for years. My pager goes off. Another admission coming up from the ER. Status post-cardiac arrest revived by paramedics needs ICU monitoring. I pocket my phone and head back to the unit. This is what I do. This is who I am. Dr. Ethan Cole, ICU attending physician at University Medical Center. The doctor people call when the case is hopeless. The one who doesn't give up. The one who fights for every patient, no matter the odds. As long as there's a pulse to fight for, you fight. That's the code I live by. The principle that's gotten me through 15 years of watching people die despite my best efforts. You don't choose who lives and who dies, you just fight. You fight until there's nothing left to fight for. I grab another energy drink from the vending machine on my way back to the ICU. My reflection in the glass looks tired. Dark circles, stubble I didn't have time to shave. The kind of exhaustion that's settled into my bones and become permanent. But tired doesn't matter. Sophie's disappointment doesn't matter. My empty apartment doesn't matter. What matters is the patient in bed 9 whose heart I restarted this morning. What matters is the admission coming up from the ER right now. What matters is being here, being ready, being the one who doesn't quit. People need me. That's enough. It has to be. The day starts at 5 a.m., and by noon I already know it's going to be one of those shifts that tests everyone's limits. The ICU is at 98% capacity. Every bed occupied, most with patients who should probably still be here next week. We're short 2 nurses because of call-outs, and the hospital is pressuring us to discharge anyone who can possibly be downgraded to step-down care. The administration sends emails about efficiency and throughput. They don't come up to the 7th floor to see what those words actually mean. I've been here 7 hours and I haven't sat down once. Bed 4 is a post-surgical complication. Bed 7 is the sepsis patient I've been fighting with for 3 days. Bed 12 is a 58-year-old woman who arrested during a routine procedure and now has uncertain brain function. Her family camps in the waiting room, desperate for any sign of improvement that I can't promise them. And then there's Bed 15, Mr. Raymond Harrison, 67, stage 4 pancreatic cancer. He came to us from the ER 3 days ago after his family found him unresponsive at home. We stabilized him, got him breathing again, ran the scans. The cancer has metastasized everywhere: liver, lungs, bones. There's a large mass pressing against his spinal cord. He's been on increasing doses of pain medication just to keep him comfortable. The chart has a note from his oncologist. 6 months ago, Mr. Harrison said he didn't want aggressive intervention if his condition deteriorated. He wanted to die at home, with hospice care, not hooked up to machines in a hospital. But his family is in the conference room now, and they're not ready to let go. I walk in to find 5 of them squeezed around the small table. 2 daughters, a son, an elderly wife, and a granddaughter who can't be more than 12. They all look up when I enter, faces tight with hope and exhaustion. I sit down and pull up Mr. Harrison's chart on the tablet. I've done this conversation 100 times before, but it never gets easier. There's no script that makes it hurt less. I explain the scan results, the progression of the cancer, the fact that he's not waking up not because of sedation, but because his body is shutting down. I explain that we can keep him alive with machines, but we can't stop what's happening inside him. The wife starts crying before I finish. One of the daughters puts an arm around her. The son leans forward, his jaw tight. He wants to know about experimental treatments, clinical trials, other hospitals with better equipment. He rattles off things he's clearly been researching online, desperately Googling his way through grief. I let him finish. Then I tell him as gently as I can that we're past the point where any of that would help. The younger daughter speaks up then. She wants to know what her father would want. She mentions the conversations they had, back when he was first diagnosed, how he said he didn't want to suffer, how he wanted to die with dignity. The son interrupts her. They argue. The wife sobs harder. The granddaughter stares at her hands. Finally, the older daughter asks me directly, "If this was my father, what would I do?" I hate this question. Hate that families put me in this position, asking me to make their impossible choices for them. But I understand it too. They're drowning, and they need someone to throw them a rope, even if it's made of painful truth. I tell them that we can continue aggressive care. We can do CPR if his heart stops. We can keep adding machines and medications. But I also tell them that at some point, we're not prolonging life. We're prolonging death. And that's not the same thing. The room goes quiet. Then the son starts crying, and I know we've crossed into the place where the decision is really being made. When the fight finally runs out of someone and acceptance begins creeping in, I leave them to talk among themselves. Tell them I'll be back in an hour. These conversations need space. Outside the conference room, I find Dr. Marcus Chen waiting for me. He's one of the second-year residents, smart and earnest in a way that reminds me of who I used to be before this job wore down all my edges. He wants to talk about Mr. Harrison, about the ethics of the situation. His voice is careful, respectful, but I can hear the question underneath the words. He mentions the DNR conversation that happened 6 months ago. Mentions that Mr. Harrison's documented wishes were for comfort care only. He's asking, in the diplomatic way residents learn to ask attendings, whether we're following the patient's wishes or the family's denial. I feel the irritation flare hot in my chest. I'm running on 4 hours of sleep and 6 cups of coffee, and I don't have the patience for philosophy right now. I keep walking. Mark is following. I tell him that we follow protocol. We document the family's wishes. We give them time to process. We don't make these decisions for them. He's quiet for a moment. Then he asks more quietly, if we're prolonging life or prolonging dying. I stop walking, turn to face him. The ICU stretches out behind him, all those beds with all those lives hanging in balance. I tell him we don't get to play God. We're doctors, not judges. Our job is to fight for life as long as there's something to fight for. The patient can't speak for himself right now. The family gets to decide, and as long as they want us to fight, we fight. Marcus nods slowly. He doesn't look convinced, but he knows better than to push. I watch him walk away and feel something uncomfortable twist in my gut. Something that might be doubt if I let myself examine it too closely, but I don't. I shove it down with all the other uncomfortable things I don't have time to feel and get back to work. The rest of the shift blurs together. Another code in bed 7. The sepsis patient's blood pressure crashes and we spend 40 minutes bringing him back. A new admission from the ER with respiratory failure. A family meeting in bed 12 where I have to tell them that their mother probably isn't going to wake up the way they're hoping. By the time I sign out to the night shift, it's past 11 p.m. 18 hours since I walked in this morning. My feet ache, my head pounds. I've drunk so much coffee that my hands have a permanent tremor. But I count the day in my head as I walk to the parking garage. 3 saves. The morning code in bed 9, stable now. The sepsis patient in bed 7, still alive despite the odds. The respiratory failure admission, intubated but breathing. 1 loss. Mr. Harrison's family finally agreed to comfort care only. He died an hour later, his wife holding his hand. I signed the death certificate. 3 saves, 1 loss. That's a good day in the ICU. Better than average, actually. I find my car on the 3rd level of the parking garage. It's one of the last ones left at this hour, sitting under a flickering fluorescent light that casts strange shadows. I unlock it and slide into the driver's seat, feeling the exhaustion settle into my bones. My phone sits in the cup holder. 3 missed calls from Sarah. 1 voicemail from Sophie that I don't have the energy to listen to. A text from my attorney about the final divorce papers. I don't open any of them. Instead, I start the car and pull out of the parking spot. The garage is nearly empty, my headlights cutting through the darkness. I navigate down the spiral ramps past the empty levels toward the exit. The city streets are quiet at this hour. I take the familiar route toward my apartment, past the 24-hour convenience store, past the closed storefronts, past the people I'll never know, living lives I'll never understand. My eyes feel heavy. The white lines on the road blur slightly. I blink hard, reach for the coffee cup in my cup holder, before remembering it's been empty since afternoon. I'm fine, just tired. I've driven home tired 1,000 times before. I think about Mr. Harrison, about the question Marcus asked, about the look in the son's eyes when he finally stopped fighting and started grieving. I think about the 3 people who are alive tonight because I didn't give up, because I fought when it would have been easier to let go. This is what I do. This is who I am. Somewhere ahead, the traffic light turns yellow. I should slow down, but I'm already through the intersection before I fully process the decision. The road stretches out in front of me, and I'm so tired I can barely keep my eyes open. But I'm almost home, just a little further. The rain starts just as I merge onto the highway. It's that particular kind of late-night rain that comes out of nowhere, turning the road into a mirror of headlights and red taillights. The wipers scrape across my windshield in a rhythm that's almost hypnotic. I should probably slow down, but I'm running on autopilot now, muscle memory carrying me home. My phone lights up in the cup holder. I glance down, another notification. I've been ignoring them for hours, but something makes me reach for it this time. 3 new voicemails, all from Sophie. I shouldn't listen while driving, I know this. I tell my residents all the time about distracted driving, about the statistics, about the split-second decisions that change everything. But I press play anyway. My daughter's voice fills the car, thin and careful in that way teenagers get when they're trying not to cry. The audio cuts off. I reach to replay it, my eyes off the road for just a second. Brake lights. Too close. Too fast. My foot slams on the brake. The car skids on the wet pavement. I wrench the wheel to the right, trying to avoid the stopped truck in front of me. The tires lose traction. Everything happens in slow motion and too fast at the same time. The guardrail comes at me sideways. Metal screaming, glass shattering, the world spinning. Then nothing. Sound comes back first. Sirens. Multiple sirens, layered over each other in a dissonant wail that I recognize from thousands of hospital arrivals. Rain hammering on metal. Voices shouting over both. I try to move and can't. Something is pinning me. Pain radiates from everywhere and nowhere at once. Too diffuse to locate, too intense to ignore. Hands on my neck. A cervical collar being fitted. I try to tell them I'm a doctor, that I know what they're doing, but my voice doesn't work right. The words come out as sounds without meaning. Bright light in my eyes. A face above me. Young, focused, professional. A paramedic's face. I try to focus on it, try to use it as an anchor, but everything keeps sliding away. Pressure on my chest. Something being inserted into my arm. Distant voices discussing me like I'm not here, like I'm just another case. I know these voices. I use these voices. Calm, efficient. Focused on the task, not the person. Never let them see you panic. Someone says something about dropping blood pressure. Someone else calls for rapid transport. The words filter through the ringing in my ears, clinical and familiar and completely surreal. They're cutting my clothes off, strapping me to a backboard, lifting me. The rain hits my face for a moment before I'm inside the ambulance and the doors slam shut. The siren starts up again, right above my head. I used to love that sound, the urgency of it. The promise that help is coming. Now it's just noise drilling into my skull. I try to catalog my injuries the way I've been trained. Mental status, altered. Pain level, significant. Ability to move. I try to move my legs. Nothing. I try again. Concentrate on my feet, my ankles, my knees. Send the signal from my brain down my spine to muscles that should respond. Nothing. The panic starts then, sharp and cold in my chest. I try to sit up, but the straps hold me down. Try to speak, but the oxygen mask muffles everything. Try to move my legs. Why can't I move my legs? A hand on my shoulder, firm, grounding. The paramedic's voice close to my ear telling me to stay still, telling me they've got me, telling me we're almost there. I know where there is. University Medical Center, my hospital, my ICU. Except I'm not going to the ICU, I'm going to the trauma bay. The rest comes in fragments. Fluorescent light streaking past, faces looking down at me, some I recognize, some I don't. The controlled chaos of a trauma resuscitation. My own protocols being performed on me. Voices calling out numbers. Blood pressure, heart rate, oxygen saturation. Someone ordering blood products. Someone else cutting away the rest of my clothes, checking for injuries I can't feel. I try to tell them who I am. Try to tell them I'm Dr. Cole, ICU attending, I work here, I know what you're doing. But the words still won't come right. The ceiling tiles slide past as they wheel me somewhere. CT scan, probably. Need to image the spine, the head. Check for internal bleeding. I know the protocol, I wrote half of it. Then morphine or something stronger and the edges go soft. When I wake up, I know immediately where I am. Hospital room, private. The beep of monitors, heart rate, pulse ox, blood pressure. All the sounds I've lived with for 15 years. The smell of antiseptic and recycled air. The particular quality of fluorescent lighting that makes everything look slightly unreal. But I'm in the bed, not beside it. I try to sit up. Pain lances through my back and I freeze, gasping. My hands work. I can lift them, see them, feel the IV line taped to my left arm. I look down at my body under the thin hospital blanket. My legs are there, both of them. But when I try to move them, nothing happens. I stare at them, willing movement. Flex your toes. Bend your knee. Something. Anything. The door opens and someone walks in. I recognize him. Dr. James Patterson, neurosurgeon. We've consulted on cases together dozens of times. Good surgeon, steady hands, no-nonsense bedside manner. Now he's my surgeon. He pulls up a chair beside the bed, and I know from the way he sits down that this is going to be one of those conversations. The kind I've had with families 100 times. The kind where you have to deliver news that will change everything. He talks. I listen. The words come at me like punches. Spinal cord injury. T12L1. Complete. Motor function compromised below the injury site. They stabilize the fracture surgically. The swelling will take time to resolve, but based on the imaging and the initial exam, the prognosis for recovery of leg function is poor. I hear myself asking about incomplete injuries, about cases where function returns, about new treatments, experimental protocols, anything. He's patient with me, gentle even. But the answer doesn't change. Paraplegia, permanent. I'll need extensive rehab, modifications to my living space, assistive devices, a wheelchair. I'll never walk again. The words sit there between us, heavy and final. I try to bargain. Tell him I can still work, I can sit, I can think. My hands work fine. I can review charts, make decisions, supervise residents. The ICU needs me. Patterson's face does something complicated. Sympathy mixed with the same pragmatism I've seen in my own face when delivering bad news. He tells me about hospital policy, about liability, about the physical demands of ICU work that I never thought about because my body just did them. Standing for hours during rounds, moving quickly between patients, performing procedures that require stability and stamina. He tells me that returning to active ICU practice isn't realistic. I want to argue, want to rage, want to tell him he's wrong, that he doesn't understand, that I've dedicated my entire adult life to this work, and he can't just take it away with a checklist of limitations. But I know he's right. I lie back against the pillows and stare at the ceiling, at the tiles I've looked at 1,000 times from the other side of these rooms. The fluorescent lights that never quite look natural. The little water stain in the corner that maintenance has never fixed. I've spent 15 years in this hospital. 15 years fighting death. 15 years being the one who makes the impossible decisions, who keeps people alive against the odds, who stands between patients and the void. And now I'm on the other side. I can't feel my legs, can't move them, can barely process what that means for everything I am, everything I've built my identity on. Patterson says something about physical therapy, about adapting, about people who live full lives with spinal cord injuries. All the things I've said to patients, all the hope I've offered when I knew their lives would never be the same. I don't want to hear it. I close my eyes and the room goes away, but the truth doesn't. My life as I knew it is over. There's no going back to who I was. No going back to the ICU where I was God, where I decided who lived and who died, where I mattered. I'm just another patient now, and I don't know who that makes me. The silence is what gets me first. No alarms, no overhead pages, no rapid footsteps of nurses responding to a code. Just the tick of the clock on the wall and the occasional murmur of voices from other rooms in the rehab facility. My room overlooks a parking lot. Not even an interesting parking lot, just rows of cars sitting still under fluorescent lights. I spend hours watching people come and go, wondering where they're going, what emergencies or ordinary days they're living through while I sit here trapped in a body that won't cooperate. They moved me here 2 weeks after the accident. The acute care phase was over. I was stable. No infections, no complications, just a broken spine and a shattered life that modern medicine couldn't fix. So they rolled me out of University Medical Center, my hospital, and brought me here to learn how to live with what's left. Physical therapy happens twice a day, morning and afternoon. The therapist's name is Monica, and she has the kind of relentless optimism that makes me want to throw things. She teaches me how to transfer from the bed to the wheelchair, a simple movement that requires coordinating upper body strength with balance, timing it so I don't tip, don't fall, don't end up on the floor needing help like a toddler. It takes me 3 days to do it without assistance. 3 days of Monica's cheerful encouragement, her steady hand spotting me, her patient repetition of the same instructions. 3 days of my arms shaking with effort, my back screaming in pain, my useless legs hanging there like dead weight I'm dragging around. When I finally manage it alone, she claps, actually claps, like I've accomplished something worth celebrating. I don't feel proud, I feel furious. 2 weeks ago, I was performing complex medical procedures, managing multiple critical patients simultaneously, making life and death decisions. Now I'm supposed to celebrate because I can get myself into a chair without falling. Monica doesn't seem to notice my anger, or maybe she's just used to it. This is a rehab facility for spinal cord injuries. Everyone here is angry about something. The exercises continue: arm strengthening, core stability, range of motion work for joints that still function, learning to use the wheelchair properly, how to navigate tight spaces, how to deal with ramps and curbs, how to conserve energy so I don't exhaust myself doing basic tasks. I go through the motions because there's nothing else to do. Because the alternative is lying in bed staring at the ceiling, and that feels too close to giving up entirely. But I don't engage. Don't make small talk with the other patients. Don't participate in the group sessions where we're supposed to share our feelings and support each other. I show up, do the work, and retreat back to my room as quickly as the chair will carry me. The anger is always there now, just under my skin, hot and acidic and looking for targets. I snap at the nurses when they're too slow bringing medication, refuse help when I should accept it, then rage when I can't do something alone. Push myself too hard in therapy and end up in even more pain, which makes me angrier and which makes me push harder. Monica tries talking to me about pacing myself, about accepting help, about the grief process and how anger is normal but not sustainable. I tell her to focus on my therapy and leave the psychology to someone else. She just nods and adds another exercise to my regimen. The denial phase lasted about 3 days. Those first days in the hospital where I kept thinking this was temporary, that I'd wake up tomorrow and feeling would return to my legs, that the doctors were wrong and I'd prove them all mistaken. Then reality set in, hard and cold. This is permanent. My legs don't work. They're never going to work again. That's when the anger arrived and decided to stay. Sarah visits once, brings Sophie with her, though I can tell Sophie doesn't want to be here. My daughter stands in the doorway of my room looking uncomfortable, her eyes sliding away from the wheelchair, from my legs under the blanket, from all the obvious ways her father isn't the person he used to be. Sarah tries to fill the silence with updates. Sophie's doing well in school. The divorce papers are almost finalized. The house sold quickly. She's moving to an apartment across town. I listen without comment. What am I supposed to say? That I'm happy for them? That I'm glad they're moving on with their lives while mine has ground to a complete halt? Sophie asks if I'm getting better. Her voice is small, younger than 16. She wants me to say yes, wants me to tell her this is temporary, that I'll recover, that everything will go back to normal. I can't lie to her. I tell her the truth, that I'm not getting better, that this is what better looks like now. She starts crying. Sarah puts an arm around her, and they leave shortly after. I don't ask them to stay. After they're gone, I sit in my room and feel nothing but a vast, empty relief that they're gone, that I don't have to perform normalcy or optimism or hope for anyone's benefit. The isolation is easier than pretending. 3 weeks into rehab, a package arrives. One of the nurses brings it to my room, a cardboard box with my name written in careful handwriting I recognize. Dr. Amanda Chen, the resident from the ICU, the one who asked about ethics, the one I was probably too hard on. I almost tell the nurse to throw it away without opening it. but curiosity wins out. Inside the box are letters, dozens of them, envelopes of different sizes and colors, some with return addresses, some without. A note from Amanda sits on top, written on hospital stationery. Dr. Cole, we thought you should see these. You made a difference to so many people. We hope this reminds you of that. Everyone misses you. Amanda. I set the note aside and stare at the pile of letters. Thank you notes from patients and their families. The ones I used to keep in my locker. The ones I read on hard nights to remind myself why I did this impossible job. Amanda must have cleaned out my locker and sent them all to me, along with new ones that arrived after the accident. I should feel touched, grateful, something warm and human. Instead, I feel nothing but a cold, bitter resentment. I shove the box into the corner of the room, next to the walker I refuse to use. But later that night, when I can't sleep because of the pain and the silence and the endless crushing boredom, I wheel over and pull out one envelope at random. The handwriting is shaky, probably elderly. I open it carefully. Dear Dr. Cole, I wanted to thank you for saving my husband's life last year. He had a cardiac arrest in the grocery store parking lot, and you were the doctor in the ICU who took care of him. He made a full recovery, and we just celebrated our 50th wedding anniversary. We wouldn't have had that without you. You are a hero. Thank you for everything you do. I read it twice. Try to remember the case? Can't. One cardiac arrest among hundreds. One save in a career built on saves. Good for them. Good for their 50th anniversary. Good for their husband who got to go home and resume his life. What about me? I saved him. I saved hundreds of people. And my reward is this: a broken body, an ended career, a room overlooking a parking lot where I get to watch other people live their lives while mine is over. I crumple the letter and throw it back in the box. The anger is back, hot and familiar. It's the only thing that feels real anymore, the only emotion that isn't hollow. I wheel back to the window and stare out at the parking lot. Cars come and go. The world continues. People live and die and move through their ordinary days while I sit here in the quiet, learning to accept that I'm no longer part of any of it. No codes to run, no decisions to make, no patience depending on me. Just silence. And anger. And the slow, grinding work of learning to be someone I never wanted to become. I saved so many people. Who's going to save me? I start reading the letters out of spite. That's the only reason I can give myself. Not because I need comfort or validation. Not because I'm looking for meaning in my shattered career. But because the box sits there in the corner like a challenge, and I have nothing but time. Monica keeps giving me the same speech about finding purpose, about the long road to acceptance, about patients who've rebuilt meaningful lives after spinal cord injuries. I've started tuning her out halfway through, counting the ceiling tiles instead of listening. The letters, at least, don't try to inspire me. I wheel over to the box one morning after a particularly brutal PT session. My arms are shaking from the effort of parallel bar exercises. Learning to support my weight, to move without my legs, to do things that used to be automatic and now require every ounce of strength I have. I pull out a handful of envelopes and spread them on the small table by my window. The first one is from a woman in Ohio. Her handwriting is neat, the kind that comes from careful practice. She writes about her husband's stroke, how I stabilized him in the ICU, how he spent 3 weeks in my unit before being transferred to rehab, how he's home now, relearning to speak, able to recognize his grandchildren. She thanks me for giving their family hope. I set it aside and open another. This one is from a younger person. The handwriting looser, more casual. He writes about a motorcycle accident. Multiple trauma. His heart stopped twice in the ER. I don't remember the case specifically, but I remember hundreds like it. Young, stupid risks that end with shattered bodies and desperate families. He writes that he finished college last spring, graduated with honors. Wants me to know that the second chance I gave him wasn't wasted. Another letter, another thank you, another grateful family. I read through 10 of them in a row. They start to blur together. Different names, different circumstances, but the same essential message. You saved someone I love. You gave us more time. You're a hero. The word appears over and over. Hero. I lean back in my chair and stare at the letters spread across the table. All these lives I touched. All these people who went home, who got better, who lived because I was good at my job. This should mean something, should fill the hollow space where my identity used to be. Should remind me that even if I can't work anymore, I made a difference. Instead, I feel nothing but a distant, intellectual acknowledgement. Good for them. Glad it worked out. I reach for another envelope. This one is different. The paper is cheaper. The handwriting is uneven, pressed hard into the page. No return address. I almost put it back in the pile, but something makes me keep reading. Dr. Cole, they said you saved my life. 3 years ago, after my third heart attack, you were the ICU doctor who wouldn't give up. You kept bringing me back even when my heart kept stopping. I want you to know what that life looks like. I can't work anymore. The damage to my heart is too extensive. I can barely walk across a room without getting winded. I spend most of my time in doctor's offices, taking medications that make me sick, managing symptoms that never go away. My wife divorced me, said she couldn't watch me die slowly. My kids visit out of obligation, but I can see it in their eyes. They're waiting for me to finally go. Since you saved me, I haven't had a single day without pain. Not one. Every morning I wake up and the first thing I feel is my chest hurting, my body failing. The weight of knowing this is as good as it gets. I know you did what you thought was right, but sometimes I wonder if you asked yourself what kind of life you were saving me for. I read it 3 times. Then I set it carefully aside and reached for another envelope. More thank yous. More gratitude. But now I'm reading them differently, looking for the spaces between the words, looking for what they're not saying. He made it to his daughter's wedding, though he was in a wheelchair and could barely stay awake through the ceremony. She got to come home, even if she needs round-the-clock care now. We're grateful for the extra 3 months, even though he was in pain most of that time. I find another letter that's less effusive, more measured. Thank you for keeping my father alive. I'm not sure he would have wanted it, but my mother wasn't ready to let go. He lived another year after his stroke. He couldn't speak or recognize us, but he was breathing. I suppose that's something. The bitterness in that last sentence sits heavy on the page. I keep reading, keep sorting. The letters split into 2 piles without me consciously deciding to do it. One pile, unambiguous success stories. People who recovered fully or mostly, who went back to their lives grateful for the second chance. The other pile, complicated outcomes. Survivors who live with chronic pain, with disability, with significantly reduced quality of life. Thank you notes that feel obligatory rather than heartfelt. Letters that thank me for keeping someone alive without celebrating what that life became. By the end of the week, I've read every letter in the box. Some of them multiple times. I start pinning them to the wall of my room. Monica raises an eyebrow when she sees what I'm doing, but doesn't comment. Maybe she thinks it's therapeutic. Maybe it is in some twisted way. The left wall becomes my success stories. Photographs of families, letters describing full recoveries, gratitude without qualification. The right wall gets the complicated ones, the thank yous that read like accusations. The letters that describe lives lived in pain, in limitation, in the shadow of what used to be. I spend hours staring at both walls, trying to tally some kind of balance sheet, trying to figure out if the math works out in my favor. 20 years of ICU work. Thousands of patients. How many of them went home to lives worth living? How many of them went home to lives they wished had ended in my unit? I never asked that question before. Never had to. Success was measured in simple terms, alive or dead, saved or lost. The scoreboard in my head only had 2 columns. Now I'm seeing a 3rd column I never counted. Saved but suffering, alive but not living, brought back to a world that no longer fits them, like me. A new letter arrives in my mail, not forwarded through Amanda this time, but addressed directly to the rehab facility. Someone must have looked up where I was sent. The envelope is plain, no return address. I open it with hands that aren't quite steady. Dr. Cole, you don't know me, but you treated my sister 4 years ago. She was in a car accident. Massive trauma. The ER doctor told us she probably wouldn't make it, but you saved her. You're very good at your job. My sister is alive. She's in a care facility now. She can't walk, can't feed herself, can't do any of the things that made her who she was. She's alive, but she's not here anymore. My parents visit her every day. They're grateful you saved her. They call you a hero. I don't. Because sometimes I look at my sister, at what's left of her, and I think you should have let her go. You should have let her die with dignity instead of condemning her to this half-life. But you don't get to play God, do you? You just follow protocol. You do everything you can because that's what you're supposed to do. I wonder if you've ever thought about what comes after you save someone. If you've ever asked yourself what you're actually saving them for. The letter falls from my hands. I sit in my chair surrounded by walls full of letters, and something inside me cracks. All these years I thought I was fighting death. Thought I was giving people the gift of life. Thought I was doing something noble and necessary. But what if I was wrong? What if some of the people I fought so hard to save would have been better off if I'd let them go? What if my job wasn't saving lives but prolonging suffering? I look at my legs, useless, at the wheelchair, at the room that's become my world, at the future that stretches out ahead of me, years of physical therapy, of adaptations, of learning to live a life I never chose. If I'd been the patient in that accident, if someone else had been the doctor, what would I have wanted them to do? Would I have wanted them to save me for this? I don't know the answer, and that terrifies me more than anything. The letter arrives on a Thursday. I've stopped counting the days since the accident, but I know it's Thursday because that's when Monica schedules the group therapy sessions I refuse to attend. I can hear voices down the hall, other spinal injury patients sharing their feelings, supporting each other, doing all the things I'm apparently supposed to be doing to process my trauma. I stay in my room and read letters instead. The box is almost empty now. I've been through most of them, sorted them, analyzed them like case studies, turned my wall into a visual representation of my career. Success on one side, complications on the other. Trying to find some equation that makes it all add up to something I can live with. The mail cart stops outside my door. The aide hands me a single envelope. Plain white. No return address. My name and the facility's address printed on a label, not handwritten. The same format as that first bitter letter I received weeks ago. My hands shake slightly as I open it. I tell myself it's from the physical therapy, from pushing too hard this morning. Not from anticipation, not from dread. The paper inside is lined notebook paper, torn carefully from a spiral binding. The handwriting is messy but legible, the letters pressed hard enough that I can feel the indentations on the back of the page. Dr. Cole, I don't know if you'll remember me. You probably don't. I was just another case to you, another file, another set of vitals on a monitor. But I remember you. It was 2 years ago, November. I ended up in your ICU after what the paperwork probably called an overdose. What I called my exit strategy, I'd planned it carefully, said goodbye to the people who mattered, left notes, made sure I'd be alone, did everything I could to make it clear that this was my choice. But someone found me too soon, called 911, and then I was in your hospital, in your ICU, and you were bringing me back. I remember fragments of it, the pain, the confusion. Your voice somewhere above me, calm and commanding, telling your team what to do. I tried to tell you to stop, tried to say I didn't want this, but I couldn't speak, couldn't make you understand. My mother was there. I remember her crying, begging you to save me, telling you I was depressed, that I didn't mean it, that I needed help, not death. You listened to her, not to me. You followed protocol. You did everything right according to the textbook. You brought me back from the edge. You restarted my heart. You forced oxygen into my lungs. You saved my life. Except you didn't. You sentenced me to continue living a life I'd already decided I couldn't bear. You took away my choice. You decided that your moral code was more important than my autonomy, that my mother's grief outweighed my suffering. You didn't save me, Dr. Cole. You trapped me. Do you know what the last 2 years have been like? Do you know what it's like to wake up every morning in a body you tried to leave, in a life you thought you'd escaped? I'm on medication now. Lots of it. Antidepressants that make me numb instead of sad. Mood stabilizers that flatten everything into gray. I go to therapy twice a week where a well-meaning counselor tries to convince me that life is worth living. Maybe for some people it is. But you didn't give me the right to decide that for myself. That day was supposed to be my end. My choice. My escape from something I couldn't survive anymore. You turned it into a life sentence. I know what you're thinking. You're thinking about duty of care, about the Hippocratic Oath, about how you're supposed to preserve life at all costs, about how depression is treatable, how people change their minds, how many suicide attempt survivors are grateful they failed. But I'm not grateful. I wake up every day wishing you had let me go, wishing you had respected the one choice I got to make about my own existence, wishing you had asked yourself, even for a moment, whether bringing me back was saving me or condemning me. You played God that day. You decided my life was worth more than my death. You made that call without knowing anything about me, about what I'd been through, about why I'd made the choice I made. And now I have to live with your decision. Every single day, I'm writing this because I want you to know. I want you to think about it. I want you to ask yourself whether you had the right to make that choice for me. I want you to understand that not everyone you save wants to be saved. You are not my savior, Dr. Cole. You are the reason I'm still trapped in a hell I tried to escape. I hope you never have to know what that feels like. The letter falls from my hands onto my lap. I can't breathe, can't think. The words loop in my head, each one landing like a physical blow. You didn't save me. You sentenced me. I close my eyes and the memory comes flooding back. November, 2 years ago. A busy night in the ICU. I'd been on for 16 hours already, running on caffeine and muscle memory. The admission from the ER, overdose. Intentional. Young patient, early 20s. Unresponsive when found, vitals crashing. I remember the mother in the hallway, screaming, hysterical, grabbing my arm and begging me to do everything. Her child was depressed, she said. This wasn't what they really wanted. They needed help. They needed me to save them. I remember the quick scan of the chart, the patient's history, previous attempts, psychiatric holds, medications that weren't working. The note from a therapist about high risk. I remember making the call, aggressive intervention, full code status. We're going to fight for this life. I remember my team moving with practiced efficiency. Lines placed, medications pushed, the patient's heart rhythm stabilizing, breathing restored, pupils responding to light. I remember calling it successful resuscitation, patient stabilized, transferred to the ICU for monitoring. I remember feeling satisfied. We got them back. Another save. Another victory against death. I never thought about what came after. I sit in my wheelchair surrounded by my wall of letters and feel something fundamental shift inside me. For 20 years, I operated on a simple principle. Life is always better than death. Any chance at survival is worth taking. You fight for every patient, no matter what. It was a clean philosophy. Black and white. Easy to apply in the chaos of the ICU where you don't have time for nuance. But this letter isn't asking me to deal with medical nuance. It's asking me to confront something much harder. What if I was wrong? What if life isn't always better than death? What if some people, not everyone, but some people, have valid reasons for choosing not to continue? What if their suffering is real and profound, and not something I can fix with my protocols and my skills, and my refusal to give up? What if I don't have the right to override that choice? I think about the mother begging me. Think about how easy it was to listen to her instead of trying to understand what the patient wanted. How the protocol supported me. How the law protected me. How I could make that decision without ever having to question whether it was mine to make. I think about standing over that patient's bed afterward, watching the monitors, feeling proud that we'd pulled off another difficult save. I never asked what they wanted, never considered that bringing them back might be inflicting more harm than letting them go, never thought about the life I was forcing them to continue living. I just followed the protocol, did my job, saved another life, and now, 2 years later, that person is somewhere wishing I hadn't. My eyes drift to the walls, to all those letters, to the scoreboard I've been trying to tally. How many people on the left wall, the success stories, actually wanted to be saved? How many of them would have chosen differently if I'd given them the choice? How many people on the right wall, the complicated outcomes, are living lives they never agreed to continue? How many people aren't on either wall because they couldn't bring themselves to write to me at all? I spent my entire career believing I was on the side of the angels, fighting death, preserving life, being the barrier between patients and the void. But what if sometimes I was the villain in someone else's story? What if my refusal to let go, my stubborn, arrogant insistence on saving everyone, was actually cruelty disguised as heroism? The thought makes my chest tight, makes my hands clench on the armrest of this chair I didn't ask to spend the rest of my life in. I understand now, in a way I couldn't before, what it's like to be trapped in a body that doesn't work. What it's like to wake up every day to a life you didn't choose. What it's like when someone else makes the decision about what you have to endure. If someone had asked me in those first seconds after my accident if I had been conscious and capable of responding, what would I have said? Would I have wanted them to save me for this? For the wheelchair and the pain and the ended career and the hollow days stretching out ahead of me? I don't know. I'm not sure I would have chosen this. And if I wouldn't have chosen it, what right did I have to make that choice for anyone else? The letter sits in my lap, accusing. Not with anger now, just with simple, devastating truth. You played God. I did. I played God every single day in that ICU. Made impossible decisions in impossible circumstances. Chose life because the alternative felt like giving up. But I never asked myself what kind of life I was choosing for them. I never asked if they wanted to be saved. I look at the letter again, at the pain bleeding through every word, at the person whose autonomy I stole because it was easier than accepting that sometimes letting go might be the kindest thing. And for the first time since the accident, I don't feel angry. I feel ashamed. I need to know who wrote the letter. The need consumes me for 3 days. I read the letter over and over, memorizing every word, every detail. November 2 years ago. Overdose, early 20s. Mother in the hallway begging me to save them. It should be enough to narrow it down, but 2 years is a long time. November is a full month, and I treated dozens of overdoses during my time in the ICU. The opioid crisis ensured that. Young people, old people, intentional, accidental, all of them blurring together in my memory. I need the medical records. That's where I hit the first wall. High-pay regulations. Patient privacy. Even as the treating physician, former treating physician, I can't just request records without cause. And wanting to know if the person I saved is still suffering isn't the kind of cause that opens doors. But I know people. I call Amanda Chen, the resident who sent me the box of letters. She's cautious on the phone, professional, asks how I'm doing in that careful way people use when they don't really want to know the answer. I tell her I'm trying to track down a former patient, someone who wrote to me. I think there might be a follow-up care issue I could help with. It's not quite a lie. Close enough that I can say it without my voice breaking. She's quiet for a long moment. Then she asks why I don't just call the hospital's patient relations department. Because I can't explain what I'm really looking for. Can't tell her that I need to know if I ruined someone's life 2 years ago and they're still suffering because of my decision. I tell her I'll try that. Thank her for her time. Hang up feeling more desperate than before. The next day, I make a different call. Dr. Patterson, the neurosurgeon who operated on me after my accident. We've kept in touch, irregular check-ins about my recovery, about adjusting to the new reality. He's been kind, professional, the right amount of supportive without being patronizing. I tell him I'm thinking about my old cases. Reflective practice, I call it. Part of processing what I've lost. There's one patient I keep thinking about, and I'd like to know how they're doing now. Patterson is quiet. Then he tells me gently that maybe this isn't the healthiest way to process my grief. I push anyway. Tell him I just need closure. Need to know that the work I did mattered. He gives me the name of someone in medical records. Tells me they might be able to help with a limited search if I have enough identifying information. Then he suggests again that I consider talking to someone. A therapist. Someone who specializes in career-ending injuries. I thank him and end the call. The medical records department is less helpful. Too many restrictions, too many policies. Without a patient name or medical record number, they can't just pull up cases based on date and diagnosis. Even if they could, they can't release information to someone who's no longer practicing. I'm hitting walls everywhere I turn, so I decide to go to the hospital myself. Monica tries to talk me out of it. Tells me I'm not ready for that kind of emotional challenge. That returning to the place where I used to work, seeing it from the perspective of a patient rather than a physician, might be more difficult than I'm anticipating. I go anyway. The drive from the rehab facility to University Medical Center takes 30 minutes. I arrange for an accessible van service, feeling pathetic for needing it. Feeling even more pathetic for the surge of something like excitement when the hospital comes into view. This was my world. For 20 years, this building was where I mattered. The accessible entrance is in the back, near the loading docks. I've never used it before. Never had to think about it. The ramp is steep, and by the time I wheel myself inside, my arms are burning. The hallways look different from this angle. Lower. The ceiling tiles I never paid attention to are suddenly very present. People's faces are higher than mine. I have to look up at everyone. A nurse I don't recognize asks if I need help. I tell her I'm fine, just visiting. The elevator to the 7th floor feels smaller than I remember. Or maybe I'm just taking up more space now. The ICU doors open with the familiar pneumatic hiss. That smell hits me immediately. Antiseptic and recycled air and something underneath that might be fear or might be hope. I've smelled it 10,000 times. Now it makes my chest tight. The nurse's station is directly ahead. I wheel toward it slowly, aware of people noticing me. Aware of the whispers. That's Dr. Cole. That's the attending. The one who had the accident. Amanda sees me first. Her face does something complicated. Surprise, concern, something that might be pity. She comes around the desk quickly. I tell her I wanted to see the place. See how everyone's doing. It's not a lie exactly, but it's not the whole truth either. She walks with me slowly through the unit. Shows me the updates, new equipment, a remodeled family room, a resident I don't know. Everything is familiar and foreign at once. We pass the room that used to be bed 15. It's occupied now, of course. A different patient, a different crisis. The ICU doesn't stop moving just because I'm gone. Amanda tells me the team misses me, that it's not the same without me. I can hear the past tense in her words. Without me. As in, I'm not coming back. I see Dr. Marcus Chen in the hallway, the resident who asked me about ethics, about prolonging life versus prolonging death. He's more confident now, moving with the kind of purpose that comes from experience. He sees me and stops, visibly uncertain about how to react. I wave him over. We exchange awkward pleasantries. He tells me he's applying for fellowship positions. Critical care, like me. Says I was an inspiration. The word sits uncomfortable between us. Inspiration. I ask him if he remembers the conversation we had about Mr. Harrison, about whether we were prolonging life or prolonging dying. His face shifts. Something cautious enters his expression. He remembers. I ask him what he thinks now. After more time in the ICU, after more cases, does he still wonder about those ethical lines? He's quiet for a long moment. Then he tells me carefully that he thinks about it all the time, that there are patients he wonders about late at night, whether they're glad to be alive or whether they're suffering because he did his job too well. I tell him I think about that too now, more than I used to. He nods, and something passes between us, an understanding that wasn't there before. My old office is occupied by my replacement. I don't go in, don't want to see someone else sitting at my desk, reviewing charts I would have reviewed, making decisions I would have made. Dr. Robert Chen, my former chief, finds me in the break room. He's older now, or maybe I'm just seeing him differently. He sits down across from me heavily, and I can see the toll this job takes written in his posture. He tells me it's good to see me, asks about rehab, about my prognosis, about my plans, all the questions people ask when they don't know what else to say. I tell him about the letter, about trying to find a former patient, about needing to know what happened after I saved them. His face becomes more serious. He asks why it matters so much. I don't have a good answer. Or rather, I have too many answers and none of them sound rational. He tells me that I did the best I could with what I had, that we all do. That medicine is messy and imperfect, and we make decisions with incomplete information in impossible circumstances. That second-guessing myself now won't change anything. But that's not enough anymore. Best I could isn't the same as right. It's not even the same as good enough. I tell him I need to know if I made the right call. If the person whose life I saved is glad to be alive, or if they wake up every day wishing I'd let them go. He's quiet for a long time. Then he says something that hits harder than any of the letters. He tells me that maybe I'll never know, that maybe that's the burden we carry as physicians. We make these life and death decisions and then we move on to the next patient, never knowing the full consequences of our choices, never getting to see the whole picture. He tells me I need to make peace with that uncertainty, that it's the only way to survive this job without going mad. But I'm not doing this job anymore. I don't have to survive it. I just have to live with what I did. Before I leave, I wheel through the ICU one more time, past the beds where I used to make my rounds, past the rooms where I made hundreds of decisions about who lives and how. I see patients I don't recognize, faces I never treated, lives hanging in balance that someone else will save or lose. And I see the ghosts of all the patients I did treat, the ones who made it, the ones who didn't, and the ones I'm not sure about, the ones who survived but maybe wish they hadn't. How many of them are out there? How many lives did I alter without asking if it's what they wanted? How many people did I trap in existences they tried to escape? The letter writer is somewhere in that number. One person among thousands. One voice finally telling me what I never wanted to hear. And I may never know who they are. That thought follows me all the way back to the rehab facility. Sits with me through the evening. Keeps me awake through the night. I saved so many people. Preserved so many lives. Built my entire identity on being the doctor who doesn't give up. But I never asked if they wanted to be saved. And now one of them is telling me they didn't. And I have no way to make it right. The uncertainty is worse than the anger was. Worse than the grief. Because at least with those, I knew what I was feeling. This is just a vast, empty space where my certainty used to be. And I don't know how to fill it. I stop going to physical therapy on a Tuesday. Monica shows up at my room at the usual time. All professional cheerfulness and encouraging energy. Ready to put me through another session of exercises designed to teach my body to compensate for the parts that don't work anymore. I tell her I'm not coming. She tries the reasonable approach first. Reminds me about consistency, about maintaining the progress we've made, about how missing sessions will only set me back. I tell her I don't care. She stands in my doorway for a long moment, probably running through her training about motivating uncooperative patients. Then she says she'll come back tomorrow, that sometimes we need a break, that she understands this is hard, but she doesn't understand. Nobody understands. I spend the rest of the day in my room, staring at the walls covered in letters, reading them over and over, the grateful ones and the bitter ones and all the ones in between, trying to find some pattern that makes sense, trying to calculate whether the math works out in my favor or if I've been lying to myself for 20 years about the value of what I did. The box of unopened letters sits in the corner. There are still some I haven't read. I can't bring myself to open anymore. Can't handle another thank you that might actually be an accusation. Another expression of gratitude for a save that might have been a mistake. Sarah calls that evening. I let it go to voicemail. She calls again an hour later. I answer this time because she'll just keep trying. She wants to know how I'm doing, if I need anything, if I've talked to the lawyer about the final settlement. Her voice is careful, measured, the tone people use when they're trying to be kind to someone they've given up on. I tell her I'm fine, everything's fine. She doesn't believe me, asks if I'm going to therapy, keeping up with PT, taking care of myself. And something in me snaps. I ask her why she cares, why it matters to her whether I'm taking care of myself when she's moved on, when she's building a new life without me, when she couldn't wait to finalize the divorce and be done with the whole mess. There's silence on the other end. Then she says quietly that she still cares about me even if we're not married anymore, that Sophie cares, that we're worried. I tell her not to be. Tell her I'm handling it. Tell her to focus on her own life and stop trying to manage mine. She says something else, but I hang up before I have to hear it. My phone sits in my hand, and I have this sudden, violent urge to throw it across the room, to smash it against the wall and watch it shatter, to break something the way I'm broken. But I don't. I just set it down carefully on the table and sit there in the dark, shaking. Monica comes back the next morning. I tell her again that I'm not doing PT. She asks if I want to talk about what's going on. I tell her no. She tries anyway, talks about the grief process, about setbacks being normal, about how common it is for patients to hit a wall around this point in their recovery. I cut her off. Tell her this isn't a wall. This isn't a setback. This is me realizing that there's no point to any of this. No point to learning to transfer from bed to chair. No point to strengthening my arms. No point to adapting to a life I never wanted and don't know how to live. Her professional mask slips for just a second. I see genuine concern in her eyes. She asks me if I'm having thoughts of hurting myself. The question hangs in the air between us. Am I? I don't know. I'm not planning anything, not actively wishing for death, but I'm also not sure I care whether I wake up tomorrow, not sure there's enough left of who I was to make continuing worth the effort. I tell her I'm fine, just tired, just need some time. She doesn't look convinced, but she leaves, probably to document this in my chart, probably to alert someone that Dr. Cole is exhibiting concerning behaviors. Good. Let them be concerned. Let them add it to the growing list of ways I'm failing to adapt to my new reality. That afternoon, I wheel over to the mirror in the small bathroom attached to my room. I haven't really looked at myself since the accident. Haven't wanted to see what I've become. But now I force myself to look. The face looking back is mine, but also not mine. Older, more tired, the kind of exhaustion that's sunk into the bones and decided to stay. My hair needs cutting. My beard is uneven from shaving with hands that shake from overuse. But it's the eyes that stop me. They're empty. Completely empty. Like someone turned off the lights and forgot to turn them back on. I lean forward, gripping the sides of the sink to keep my balance. How many people are out there right now wishing I'd failed? The question comes unbidden, but once it's there, I can't shake it. How many people are looking in mirrors just like this one, seeing emptiness just like this, and thinking about the doctor who wouldn't let them go? How many lives did I force to continue when ending might have been kinder? How many people are trapped in bodies they didn't choose, in lives they didn't want, because I was too arrogant to consider that maybe death isn't always the worst option? I'm one of them now, living in a body that doesn't work, waking up every day to a reality I never chose. And for the first time, I have to ask myself the question I never asked any of my patients. If someone had asked me in those seconds after the accident, before the paramedics arrived, when I was conscious enough to think, would I have wanted them to save me for this? For the wheelchair? For the ended career? For the physical therapy sessions learning to do basic tasks? For the empty days in this room, reading letters from people whose lives I altered without permission? Would I have chosen this? I look at myself in the mirror and I don't know the answer. Maybe I would have. Maybe survival instinct would have kicked in and I would have begged them to do everything. Or maybe if I'd known what this would feel like, I would have asked them to let me go. And if I'm not sure if I can't honestly say I would have wanted this, then what right did I have to make that choice for anyone else? The person who wrote me that letter didn't want to be saved, made that clear before they lost consciousness, begged not to be brought back. And I brought them back anyway, just like someone brought me back, made decisions about my body without my input, decided that my survival was worth more than my choice. I understand now. Understand the anger in that letter, the sense of violation, the feeling of being trapped in a life sentence you never agreed to serve. I wheel back to my room and look at the letters covering my walls. All these people, all these lives I touched, all these decisions I made. How many of them are glad? How many of them are suffering? How many of them are somewhere in between, grateful to be alive but wondering if the cost was worth it? I grab the first letter within reach and tear it down from the wall. Then another. Then another. They scatter across the floor like confetti. Thank yous and accusations and everything in between. All these voices I thought were validating my career, now just noise I can't process anymore. I pull down more. The tape tears chunks of paint from the wall. Papers crumple and tear in my hands. Success stories and complications and all the lives I thought I saved. The box is there, still half full of letters I haven't read. I tip it over, dumping the contents onto the floor with everything else. What's the point of any of it? What's the point of reading about lives I can't fix? Decisions I can't unmake? Consequences I can't control? I grab a handful of letters and rip them. The paper tears easily, not satisfying enough. I grab more, shredding them, tearing them into smaller and smaller pieces until my hands hurt, and my arms are shaking and the floor is covered in paper fragments like snow. Monica must hear the noise because she appears in my doorway, her eyes wide. She says my name, asks if I'm okay. I laugh. Actually laugh. The sound comes out harsh and broken. Am I okay? I'm sitting in a wheelchair surrounded by the wreckage of my career, having just destroyed letters from people whose lives I may or may not have ruined, unable to even answer the basic question of whether my own survival was worth it. No, I'm not okay. I tell her to leave. Tell her I want to be alone. She hesitates, probably running through protocols about patients in crisis, probably deciding whether I'm an imminent danger to myself. I'm not. I'm just angry, broken, lost. She leaves, but I know she'll be back, with reinforcements probably. A counselor, maybe a psychiatrist, all the people they deploy when someone is having what they delicately call a setback. I sit in my room, surrounded by torn paper and broken certainties, and let myself hit bottom. Because maybe that's what I need. To fall all the way down. To stop pretending I'm handling this. To stop trying to be the stoic physician who faces adversity with dignity. I'm not that person anymore. I don't know who I am. All I know is that for 20 years, I believed I was doing good. Believed I was saving lives. Believed that any life was better than death, and that my job was to preserve life at all costs. And now I don't know if any of that was true. I don't know if I was a hero or a villain, or just a scared human being making impossible choices in impossible circumstances. I don't know if the person who wrote that letter is better off alive, or if I condemned them to prolonged suffering. I don't know if I would have wanted someone to save me for this. And I don't know how to live with any of that uncertainty. The torn letters cover my floor like casualties. And I sit in the wreckage, finally admitting what I've been avoiding since the accident. I'm not okay. I haven't been okay for a long time. And I don't know how to fix it. I wake up on the floor. Not literally. I'm still in my chair, slumped sideways against the armrest where I must have passed out sometime in the early morning hours. My neck aches from the angle. My mouth tastes like old coffee and exhaustion. The room is exactly as I left it. Torn letters covering the floor. The walls bare except for pieces of tape and torn paper. The empty box tipped on its side. Morning light filters through the window, making the destruction look somehow worse in its clarity. Last night's rage has burned out, leaving only ash and the hollow feeling of having broken something I can't put back together. Monica doesn't come for our usual session. Someone else arrives instead. A counselor named David who introduces himself with the kind of gentle professionalism that makes it clear Monica reported last night's breakdown. We talk. Or rather, he talks and I give minimal responses. He asks about crisis plans and support systems, and whether I'm having thoughts of self-harm. I tell him no, I'm not planning anything, I'm just tired. He doesn't push, just leaves his card and tells me he's available anytime. The door closes quietly behind him, and I'm alone again with the wreckage. I spend most of the day just sitting, not reading, not thinking, not doing anything, just existing in the space where the anger used to be. By evening, something shifts. Not hope exactly, not acceptance either. Just a quiet recognition that I can't stay in this moment forever. That eventually I'll have to decide what comes next, even if I don't know what that looks like. I start picking up the torn letters. Not all of them. Some are destroyed beyond recognition. But the ones that are still readable I gather into a pile. Sort them from the debris of my breakdown. They're just paper. Words written by people I'll probably never meet. They can't fix what's broken inside me. Can't answer the questions that keep me up at night, but they're also evidence. Proof of 20 years of work, of lives touched for better or worse. I wheel to the small desk in my room and pull out a notebook. One of the blank ones they gave me in rehab for journaling, which I've ignored until now. On the first page, in careful handwriting that still looks like mine, I write, "People I saved and those I failed." Then I pause. The title feels wrong. Too binary. Too much like the old scoreboard I used to keep in my head. I cross it out and write instead. The list. Just that. Simple. Honest. I sit with the blank page for a long time. Where do I even start? 20 years of patience. Thousands of cases. I can't remember them all. Can't possibly document every decision I made, every life I touched. But I can remember some. I start with the ones that haunt me, the ones I think about when I can't sleep. Mr. Raymond Harrison. November, 3 years ago. Stage 4 pancreatic cancer. Family wanted everything done. Patient had DNR discussions with oncologists, but family overrode. Kept on ventilator for 3 weeks. Died in ICU, not at home like he wanted. Outcome. Failed him. Followed protocol instead of his wishes. Writing it down makes it real in a way it wasn't before. Makes me accountable for that choice. Not to some abstract ethical principle, but to the actual person whose death I made harder than it needed to be. I continue. Sarah Mitchell, heart attack, age 52. Full code, successful resuscitation. Went home 2 weeks later. According to letter from husband, celebrated 50th anniversary. Outcome, success by most measures. She seems glad to be alive. Michael Torres. Motorcycle accident, age 23. Multiple trauma, cardiac arrest and ER. Brought him back. Long recovery but graduated college. Outcome, he called it a second chance. Seems grateful. Patient name unknown. November 2 years ago. Overdose, early 20s. Didn't want to be revived. Family insisted. I followed family's wishes over patient's expressed desire. Outcome, still suffering. Wrote to tell me I sentenced them. Was right to do so. The pen stops on that one. I read it over several times. This is the truth I've been avoiding. Not every save was right. Not every life preserved was a life that should have been preserved. And hiding behind protocol, behind doing what I was trained to do, doesn't absolve me of responsibility for those choices. I keep writing. Name after name, case after case. The ones I remember clearly and the ones that are just fragments. The successes and the failures and all the complicated outcomes in between. Some entries are long, detailed. Others are just a name and a date and a question mark, because I don't know what happened after they left my care. I write for hours. My hand cramps. My back aches from sitting in one position. But I keep going, pulling names from memory, from the letters scattered on my floor, from the guilt that's been building since that first bitter letter arrived. Somewhere around midnight, I stop. Look at what I've written. It's not a complete list, not even close. But it's something. An acknowledgement of the complexity I spent 20 years ignoring. An admission that my neat categories of saved and lost were never adequate to capture the actual human cost of the decisions I made. I wasn't God in that ICU. I was just a tired, scared human in a white coat, making impossible calls with incomplete information and too little time to think them through. That doesn't excuse the mistakes, doesn't make it okay that I ignored patient wishes in favor of family grief or protocol convenience. But it does make me human instead of hero or villain. Just human. Flawed and failing and trying my best in circumstances that were never designed for best to be good enough. I pull out a fresh sheet of paper. The letter writer, whoever they are, wherever they are, deserves a response. Not an excuse, not a defense, just honesty. I write. To the person I saved when I shouldn't have, "You're right, I didn't ask what you wanted, I didn't listen when you tried to tell me. I heard your mother's grief instead of your choice. I followed protocol instead of respecting your autonomy. I thought I knew better. Thought that any life was better than death. Thought my job was to preserve life at all costs, and that cost included your right to decide for yourself. I was wrong. I don't know if this matters to you. I don't know if an apology from the person who trapped you in a life you didn't want is worth anything. Maybe it's just self-serving, me trying to feel better about something I can't fix. But for what it's worth, I'm sorry. I'm sorry I didn't ask. I'm sorry I didn't listen. I'm sorry I played God with your life when I had no right to that role. I can't undo what I did. Can't give you back the choice I took away. But if there's anything I can do for you now, even if it's just listening in a way I should have listened then, I'm here. You taught me something I needed to learn. That saving isn't always saving. That life isn't always the better option. That some choices should belong to the person living with the consequences, not the doctor making the call. I wish I'd understood that when it mattered. I understand it now. I'm sorry I learned it too late for you. Dr. Ethan Cole, I read it over 3 times. Change a few words. Take out anything that sounds like excuse-making. What's left is just truth. Hard and uncomfortable and long overdue. I don't know if they'll ever read it. Don't even know how to send it given the anonymous letters with no return address. But I fold it carefully and tuck it into my notebook, next to the list. Maybe someday I'll find a way to deliver it. Maybe not. What matters is that I wrote it. That I stopped hiding behind the role of savior and took responsibility as a human who made mistakes with other humans' lives. The room is quiet. The torn letters still cover my floor. The list sits on my desk, incomplete and honest. I'm not fixed, not healed, not even sure I'm on the path to acceptance yet. But I'm not hiding anymore either. And maybe that's where actual recovery starts. Not with feeling better, but with facing what I did, the good and the bad and all the complicated space between, and finally admitting that I wasn't the hero I thought I was. Just a person, making choices, getting some of them right and some of them catastrophically wrong, and living now with the consequences of both. The letter comes 6 weeks later. I've stopped checking the mail obsessively by then. Stopped waiting for a response to the apology I wrote and rewrote 3 times before finally sending it to University Medical Center's Patient Relations Department, hoping they could forward it to whoever sent the anonymous letters. I don't know if it ever reached them. Don't know if they read it. Don't know if it mattered at all. But I've started to accept that I might never know. That some conversations don't get neat endings. That I'll have to live with that uncertainty. So when the aide delivers my mail and there's a plain envelope with no return address, I almost don't open it. Almost toss it aside with the hospital bills and insurance paperwork. But something makes me tear it open. The handwriting is the same. Messy but legible. Pressed hard into the page. Doctor Cole, I got your letter. It took me 3 weeks to decide whether to respond. Part of me wanted to ignore it. Part of me wanted to write back and tell you that your apology changes nothing, that I'm still here, still suffering, still trapped in the life you forced me to continue. All of that is still true, but I'm writing anyway because something in your letter felt different than what I expected. You didn't make excuses. You didn't try to convince me you did the right thing. You just admitted you were wrong. That matters. I don't know if it helps, but it matters. I'm not going to tell you I forgive you. I'm not sure I can. What you did, what that day cost me, isn't something I can just put behind me because you finally understood what you should have understood then. But I will say this. I spent 2 years angry at you, angry at my mother, angry at everyone who decided I should live when I decided I shouldn't. And that anger was eating me alive on top of everything else I was dealing with. Your letter didn't fix that, but it did something I wasn't expecting. It gave me someone to be angry with who was actually listening, who wasn't defending themselves or telling me I should be grateful, who was just there, accepting responsibility. I don't know what happens now. I'm still in therapy, still on medication, still trying to figure out how to exist in a life I didn't choose. But maybe that's the point. Maybe we're both learning how to exist in lives we didn't choose. I don't have anything else to say. I just wanted you to know I got your letter, and that it mattered. J, just the initial. No name, still anonymous, still protected. But it's something. An acknowledgement. Not forgiveness, not reconciliation. Just a bridge between two people learning to live with impossible circumstances. I read the letter 3 times, then fold it carefully and add it to my notebook, next to the list in my apology. It's not the ending I wanted, not the absolution that would make everything better, but it's real, and honest, and more than I deserved. Monica notices the change in me over the following weeks. I start going to PT again, not with enthusiasm exactly, but with a quiet determination that's different from the rage or the despair. I'm learning to accept that this is my body now. These are my limitations. And while I didn't choose them, I can choose how I respond to them. It's not the same as being okay with it, but it's something. The real change comes when I'm contacted by a woman named Helen from the hospital's patient advocacy office. She explains that they've started a pilot program for post-ICU support. Too many patients and families struggle with trauma after intensive care. They're looking for someone who understands both sides, the medical complexity and the human cost. Would I be interested in volunteering? Talking to families navigating difficult decisions? Helping people understand what to expect? What questions to ask? How to make sure their loved ones' wishes are respected? I almost say no. Almost tell her I'm not the right person for this, that I spent 20 years making the exact mistakes this program is trying to prevent. But then I think about the list, about all the names and cases and outcomes I've been documenting, about learning to live with being wrong instead of hiding from it. I tell her yes. The first family I talk to is terrified and exhausted and desperate for someone to tell them what to do. Their father is in the ICU after a massive stroke. The doctors are talking about long-term care facilities, feeding tubes, tracheostomies. The family doesn't know if he would want any of that. I sit with them, not as a doctor anymore, but as someone who's been on both sides of these impossible decisions. And I ask them questions. What did he value? What made his life meaningful? What did he say about quality versus quantity? What fears did he express about aging, about losing independence, about being a burden? We talk for an hour. I don't tell them what to do. Don't push them toward any particular choice. I just help them find their own answers. Help them hear what their father might have wanted instead of what they wish they could have. By the end, they're still scared, still grieving, but they're not alone in the decision anymore. A week later, they call to tell me they decided on comfort care. Their father died peacefully 2 days ago. They wanted to thank me for helping them honor his wishes. I cry after hanging up. Not from sadness exactly, from something more complicated. Relief, maybe, or recognition that I'm finally learning what I should have known all along. Saving doesn't always mean bringing someone back. Sometimes it means helping people let go. I start doing more of these consultations by phone, by video chat, occasionally in person when families come to the rehab facility to meet me. I talk to patients who've survived ICU stays and are struggling with PTSD, with survivor's guilt, with bodies that don't work the way they used to. I share my own experience, the wheelchair, the ended career, the slow process of learning to build a life from what's left. I'm not inspirational, I'm just honest, and somehow that helps. The list in my notebook keeps growing. Not just the old cases I'm remembering, but new names, people I've talked to, families I've supported, patients who've shared their stories with me. Next to each name, I don't write saved or lost anymore. I write things like helped family understand father's wishes, chose hospice, peaceful death, talked to ICU survivors struggling with PTSD, connected them with therapist, followed up twice, consulted with family about DNR decision. They chose full code, patient recovered, no regrets, different outcomes, different choices, but all of them centered on one principle I never valued enough before. The person's autonomy matters more than my need to save them. 6 months after that first letter, I'm back at the hospital. Not as a doctor, as a volunteer consultant for the ICU Ethics Committee. We review difficult cases, talk about patient autonomy, discuss how to balance family wishes with patient values. I share my own failures, the cases where I got it wrong, the lessons I learned too late. The residents listen. Some of them look skeptical. This is the legendary Dr. Cole admitting he screwed up. But others lean forward, ask questions, want to know how to do better. I tell them the truth. I don't have all the answers. I made mistakes. Big ones. Hurt people I was trying to save. But I learned that saving isn't just about keeping someone alive. It's about honoring their humanity, their choices, their right to decide what kind of life or death they want. That evening, I wheel back to my apartment, the one I finally moved into after leaving the rehab facility. Adapted for accessibility, smaller than my old place, but mine. The box of letters sits on a shelf. I've kept them all, even the torn ones, even the bitter ones. My notebook sits beside it. The list has grown to over 100 names now, some from my ICU years, some from my new work. I open to a blank page and write, what I've learned. Saving doesn't mean bringing everyone back. Saving doesn't mean ignoring what they want. Saving doesn't mean I get to play God. Sometimes saving means helping someone die with dignity. Sometimes saving means helping a family let go. Sometimes saving means listening instead of acting. Sometimes saving means admitting I was wrong. I used to measure my worth by how many people I kept alive, by the tally in my head of saves versus losses. Now I measure it differently. Did the person have a choice? Were they heard? Did I respect their autonomy even when it meant letting go? I'm not perfect at it. Still learning, still making mistakes. But I'm asking the questions now, the ones I never asked before. And maybe that's what real saving looks like. Not the heroic interventions, not the dramatic rescues, but the quiet, humble work of honoring people's humanity. Even when, especially when, it's hard. The notebook closes. The box of letters sits silent, and I sit in my wheelchair in my adapted apartment, finally beginning to understand what my 20-year career in the ICU never taught me. That the most important saves aren't always the ones where someone walks out of the hospital. Sometimes they're the ones where someone gets to choose how their story ends, and the doctor brave enough to let them make that choice.